Welcome to our Weill Cornell Breast Cancer Survivorship Lecture on nutrition, vitamins, and minerals. I am Dr. Ann Moore, medical oncologist and director of the Breast Cancer Survivorship Program. There are more than 3.5 million breast cancer survivors in the United States, mostly women for sure, but about 1% are men. Our Cornell Survivorship Program is focused on understanding the needs of the breast cancer patients who have completed the first few years of treatment. What do our patients ask for? Well, apart from excellence in medical care and careful follow-up, they are asking us for information. What they can do and what they can do to decrease their chance of a cancer recurrence, and what they can learn from the latest research. Today's topic, nutrition, vitamins, and minerals, covers an important area of great interest to our patients. In preparation for this talk, we did a detailed survey of 50 patients in our practice, all women, about what kind of vitamins and minerals they were taking. These results will be presented at the San Antonio Breast Cancer Conference in December, but I thought I would give you a preview of this interesting information. The group that was surveyed were 50 women who had appointments scheduled in May and June of this last year. The average time since their cancer diagnosis was 14 years, and the age ranged from 46 to 87. 85% of these women were taking vitamin D, followed by calcium as the next most common, and vitamin C. 16% of the group were taking a multivitamin. Only 4 of the 50 women were taking no vitamins at all. Rare but interesting supplements included ginseng root tea, shiitake extract, and camwo tea. A big question we asked in our study is whether the doctors and nurses who care for these 50 women know what they are taking. And I wish I could poll this audience. I wish I could see you all tonight, but to see what you would guess about how many women had a completely accurate list of the vitamins and supplements that they were taking placed in their electronic medical record. Well, I'm sure you're not going to guess that 100% had an accurate record. But I don't think you would guess what we found, which was that none of the women had a completely accurate list of vitamins and supplements that they were taking. So while we want to educate our patients about this field, we certainly need to educate the medical professionals too. Is it important that physicians and nurses taking care of our breast cancer survivors know what they are taking? I think it is. And no one is more expert in this area than our speaker today, Dr. Alka Gupta. Dr. Gupta is representing Integrative Medicine Program at Weill Cornell. She is a leader in the effort to transform America's healthcare system to one that promotes an integrative and comprehensive approach. Welcome, Dr. Gupta.
Thank you so much, Dr. Moore. And thanks to everybody here for coming in tonight. And thanks for having me. That was such a generous introduction, and it usually is. It's just really nice to me to be able to see communities together these days, and especially this one. So I am very happy to be here, and I'm going to do my best to answer all of your questions to the best of my ability today. So Dr. Moore mentioned that I have helped to launch and to lead the Integrative Health and Wellbeing Program. And there are a lot of confusing terms out there. So I just want to take a minute at the beginning to clarify and maybe answer some of the questions that some of you might have. Integrative health and medicine is quite different from alternative medicine, which became very popular here in the US back in the 60s and in the 70s, where people were seeking out non-evidence-based care or non-standard of care in place of standard of care. Now, we know that alternative medicine leads to poor outcomes. So from there came complementary medicine, where a person may go over here to see their primary care doc, maybe see their neurologist for their migraines, and then may go elsewhere to receive massage therapy or something else to help relieve the muscle tension that leads to their migraines. Now, it's better than alternative medicine, but it can still lead to some fractured care because sometimes the right hand does not talk to the left. And from there was born integrative medicine, where we aim to bring in evidence-based therapies, new approaches that have science behind them into the conventional care system where you would seek out the rest of your care. The benefit there is there's good communication between your healthcare team and providers, and it can also be provided to those who would benefit earlier and also within some physician oversight. Now, today we're talking about nutrition and nutrients, which is a really important topic, both to me and to health. Now, the primary way that we get our nutrients or don't get our nutrients is through food and drink. So although today we're talking about nutrients really in the context of illness, what we eat and drink every day also profoundly impacts all other areas of health, including both physical health and also mental health. And we see those impacts short-term, day-to-day, and also long-term over years and decades. Now, there's a lot of conflicting information out there. Every time I read an article, like a news article or see something on social media, sometimes it seems like we're receiving different messages. When you look at some of these patterns of eating, you might notice that some of these patterns, actually all of these patterns, focus on exclusion. They focus on limiting carbohydrates or limiting solid foods in some instances, or in this case, limiting a whole lot of things. Now, these diets each have some merit behind them. They have something driving them, and they come from somewhere, usually rooted in science, but they're not the whole picture. Rather than thinking about all of the things not to eat, I think it's more important to think about what to eat, what to drink. I think that's a much more nourishing way to think about it. And also psychologically, it's a whole lot more effective and a lot more sustainable than thinking about all the things we should not be eating. Now, I know you're all curious about specific foods, specific nutrients, things that we should increase or things that we should decrease in the context of breast cancer. So let's spend a few minutes talking about specific nutrients and what we should know about them. One cool category of nutrients are the sulforaphanes and indole-3-carbinol. These are compounds that are present in a lot of our cruciferous foods, foods like broccoli, white cabbage, cauliflower, and Brussels sprouts. And we see in vitro, they have pretty powerful anti-tumor effects. They can suppress tumor cell proliferation. They can affect cell signaling in a beneficial way. And they even have interesting other mechanisms like epigenetic ways of working. And by epigenetic, what we mean is in our genome, in our DNA, we have, humans have about 20,000 genes, but that only makes up 1 or 2% of our human genome. The rest of that is likely what influences when genes are on, when genes are off through epigenetic mechanisms. And so these compounds can work in those ways to suppress or upregulate certain genes. Vitamin D is a big one. Implicated in a lot of different areas of health, including immunity. It's a hot topic right now, including certain types of cancers, including other areas as well. And we do know that there's a correlation between an association, a correlation between vitamin D deficiency, total vitamin D, and breast cancer. What I recommend here is really having your vitamin D level checked. It's one of those nutrients that we can reliably check and reliably monitor over time, and supplement if it's low or borderline. Usually the normal lab values are going to be around 30 and up. Frankly, in my patients, I will aim for a range somewhere between 40 and 70, maybe 40 and 80, because it's really difficult to control very tightly. So a large range is helpful. Vitamin D is also one of those nutrients that is stored. So it's fat soluble. That's how we absorb it. We absorb it with fat, and it can stack because your body retains it. It's not a water soluble vitamin that we use and then excrete through urine. So you can definitely overdo vitamin D if you're constantly taking like 5,000, 10,000 units of vitamin D a day and not having those levels checked. So I suggest having it checked if you haven't. The conversation about soy has gone back and forth a lot over the last few decades. In terms of supplemental soy isoflavones, there's mixed data on the relationship between those and the risk of breast cancer. In general, the consensus is to avoid supplementing soy, but it is okay to consume whole food sources of soy. And we can find soy in foods such as edamame, soy nuts, soybeans, tempeh. We can actually find it in a lot of places. A lot of our foods these days are actually, they have soy as a filler or as an additive in food. So if you were to look in your pantry, you might find soy as an ingredient in a lot of unexpected foods. So those more processed forms of soy are less desirable. EGCG, one of the active compounds in green tea. Data has shown for some time that it might provide some protection against the recurrence. Green tea contains several biologically active types of compounds, including catechins. EGCG is one of those. But also flavanols and others, and they work in a variety of different ways. They are potent antioxidants. They also work in epigenetic ways. They may also decrease the angiogenesis, which is basically the generation and growth of blood vessels where we don't want them. That potential protective effect appears to occur once you're at 2 cups a day or a bit higher. There's a caveat there because green tea, just like white tea and black tea, is caffeinated. So if you're a person who's sensitive to caffeine or may not get as much sleep after caffeine, or might find yourself a little nervous or anxious or jittery, tremulous after caffeine, this might not be something that is the right thing for you. It's certainly not necessary for everybody. Beta carotene, higher levels of beta carotene is associated with reduction in risk. Now, I usually don't recommend supplementing with beta carotene because there is no such thing, for example, as a supplement or a nutrient that only has upside. Everything that has a potential benefit also comes with a potential downside. And whenever we're talking about a supplement or a nutrient, if we're taking it in a tablet or capsule form, I usually treat it just like I do a medication. I'll treat it like a pharmaceutical. Do the benefits outweigh the risks? And it's really important to think about that each time you add something to your medication list. But a good way would be to incorporate more foods that are rich in beta carotene, which tend to be these beautiful orange and yellow orange foods. The classic one here is carrots. if you do have too much of those, you can actually see that the palms of your hands, the soles of your feet can actually turn orange. And that is an early sign that you're overdoing it. That's an early sign of toxicity. So that's the point at which you should pause and maybe take a couple of steps backwards. Omega-3s also really important here, and also important in a lot of other areas of health also. We know that omega-3s are quite anti-inflammatory. They do reduce inflammatory derivatives. They also are beneficial in reducing growth factor receptor signaling in vitro, so not in human studies so much, but in cell-based studies, and can decrease inflammatory cytokine production. The ideal way to get this would be through a diet that's rich in omega-3s, such as foods like wild fatty fish, nuts such as walnuts, seeds like flax and chia seeds. But many people can also safely supplement with omega-3 if you're unable to incorporate small amounts of those foods several times a week. Like I said earlier, there is no such thing as a nutrient or a supplement that only has an upside. Omega-3 also has a mild blood thinning effect, so it's not right for everybody, but certainly the majority of people can take it safely if they want to. Vitamin B9, or what we call folate, also seems to have a higher protective effect. Well, it's associated with a decreased risk of hormone receptor negative breast cancer. And the protective effect also appears to be higher in those with the BRCA1 mutation. If we're eating plenty of leafy greens, foods that you can see up at the top here, you're probably getting at least what you need in a day, if not a bit more. If that is not feasible, if you cannot eat a diet that's rich in folate or B9, then you can consider supplementing either on its own or in a multivitamin with about 400 micrograms of folate a day. Vitamin B6, also associated with changes of risk in breast cancer. I also recommend getting that through foods, which you can find in soybeans, in some legumes, in some nuts, and also in some meats. And vitamin C. There's also mounting levels of data that show that dietary vitamin C, as well as possibly supplemental vitamin C, might be associated with a post-diagnosis benefit. And it's being studied as potential adjuvant therapy in the future. I think we'll probably understand more over time how antioxidants in general, and also vitamin C, can be effective. They probably work through multiple mechanisms. And by incorporating foods such as citrus, such as tomatoes, such as peppers, you can get broccoli, you can get quite high levels of vitamin C through your diet. So you might have noticed that the slides over the last several minutes have had pictures of foods and not of tablets and capsules. There are certainly nutrients that we can get in much higher doses through capsules and tablets, and we simply can't get them through foods. But the evidence behind high dose supplementation is simply not there, generally speaking, not there yet. There's a lot that we get through food also beyond the nutrient itself, right? So eating an orange is giving you much more than a dose of vitamin C. Many foods are synergistic. So for example, we absorb iron better when we have it with vitamin C. Naturally, that's going to work better with foods. There are many vitamins that we absorb better when we have them with other foods, such as fat-soluble vitamins, right? Vitamins A, vitamins D, E, and K. And so those are just some simple, well-known examples of how foods, when we eat them, can actually be quite synergistic in a way that supplements cannot be. Another example, when we eat foods, we're not just getting those nutrients, we also get the stuff along with it. So for example, a high fiber diet has been shown to be effective and beneficial. It's been associated with a reduced estradiol concentration in women with breast cancer, even when it wasn't associated with other things such as weight loss. Independently, increased fiber intake was related to the reduction of serum estradiol concentrations. So in addition to foods being synergistic, the way that we spend everyday life can be synergistic. In fact, the way that we eat and the way that we move are very synergistic. When we combine the two of those things into a healthy and into a nourishing lifestyle, it can impact breast cancer in other ways too. We tend to focus, like when you go to the doctor's office or when you're at home by yourself, we tend to focus a lot on weight because it's easy to measure. You step on a scale, you have a number, and it's either the same or higher or lower. But what's more important is our bodies. What is our body made of? What is it composed of that day? And with both components, or two of many components of a healthy lifestyle, we can actually achieve a lower healthy fat mass and a healthy muscle mass. The way that a lot of us live, you know, we live, eat, and work while sitting down. And we often have to think about moving because it's not naturally incorporated into every day. When we do that, we shift this balance to usually a higher fat mass and a lower skeletal muscle mass. But these tissues are quite active. So muscle mass is quite metabolically active. When it's active, it can help to lower growth factors and hormones such as insulin. Likewise, fatty tissue, what we call adipose tissue, is also quite active. It is pro-inflammatory. It increases the conversion to estrogen and has several other downstream negative metabolic effects. So when we make these changes, we actually decrease insulin, we decrease certain growth factors, we decrease inflammatory cytokines, and potentially decrease circulating estrogen, which in many cases can lead to a decrease in tumor progression and decreasing the risk of recurrence over a long period of time. In fact, a study that was published several years ago now followed about 1,500 women who were diagnosed and treated for early stage breast cancer for a couple of years after diagnosis. And they looked at these two components. They looked at vegetable and fruit consumption, not even other components, just how many vegetables and fruits did you have per day? And they looked at levels of physical activity. And they found that those who ate lots of vegetables and fruits and were in the high physical activity group actually had a survival benefit. And really study after study after study shows that optimizing nutrition and physical activity are probably the most important areas to focus on during and after treatment. It doesn't mean instead of the rest of treatment, but in terms of what's within our control, these are probably the two areas that we should focus on. I mentioned food by itself can have an impact on inflammation. You might be curious what specifically. We know that diets that are rich in vegetables and fruits appear to lower the inflammatory response, decreasing circulating inflammatory cytokines. And we know that diets that are high in refined starches, sugars, saturated fats, trans fats, appear to turn on the inflammatory response. So you can imagine if you were to have one meal that is not so great, it might impact your body's circulating levels of these things, but temporarily. The problem really occurs when that's the norm and we're doing that day after day, week after week, month after month. So I promised we would focus in on not what not to eat, but focus on what is nourishing, what is healthy, what should we be eating. The foods that we want to emphasize the intake of include vegetables and fruits. It's not necessarily a low carb diet, but carbohydrate intake is coming from vegetables, fruits, and whole grains. It includes lean sources of protein, which could be plant-based sources of proteins like legumes, beans, or fatty fish, or other lean sources of protein such as poultry, and healthy sources of fats, things like nuts and seeds. Foods that, if we eat that way, you'll probably just be less hungry for the other stuff, and you'll probably crowd out the sweets, you'll probably crowd out the sweetened drinks, you'll probably crowd out multiple portions of red meats per week and processed foods. If we feel like we're already eating in this way, then it might be a good idea to take the next step and look at a couple of other things, including maximizing certain things, maximizing micronutrient intake, maximizing vitamin and mineral intake through foods, and maximizing antioxidant intake. Things that you might then consider minimizing afterwards would be food additives, refined carbohydrates, things like white breads, white pastas, cookies, crackers, things like that. Limiting high sodium foods. And we also know that alcohol is not our best friend in this case. So limiting alcohol to something that is reasonable, feasible, something that's sustainable for you long-term is important too. So if for you that's 2 drinks a week, maybe for you it's 4 drinks a week, maybe for you it's really easy to give up entirely. I usually suggest picking a comfortable goal that's on the lowest end. So when you're sitting down to your next meal, if you're on the East Coast, maybe dinner tonight, this is a way to do a quick self-check to see if you're setting yourself up for success. This is the Harvard School of Public Health Healthy Plate diagram, and you'll see, we're not going to talk about necessarily the oils in the water today, but just take a look at these main components. The goal is half the plate is vegetables, fruits, or both. So if you don't like fruits, it could be all vegetables. Mostly non-starchy vegetables. So this whole half of the plate maybe shouldn't be potatoes or sweet potatoes. Try to choose non-starchy vegetables for this half. That'll have fiber, it will have nutrient density, and it will also have quite a bit of volume, so you'll feel full. That third quarter of the plate consists of a whole grain, which could be a brown rice, it could be a whole wheat pasta, or it could be something else like quinoa or millet or buckwheat or any of the other whole grains, whatever you enjoy. And then that fourth quarter is a healthy protein. So one of those lean proteins that we talked about. This is the Canadian version of the healthy plate, which I just think is a lot nicer to look at. But you'll see what an actual plate could look like. It doesn't have to look exactly like this, but you'll see that they're doing the same thing with half the plate with vegetables and fruits, a quarter with a lean protein, another quarter with a whole grain. This way of eating is not only important for what we're talking about today, but really important for preventing a whole host of illnesses, including type 2 diabetes, including heart disease, including even some other types of cancers, and even probably delaying or preventing some cases of cognitive decline due to Alzheimer's disease. So today's talk is on food, but as we all probably know, there are a lot of impacts that breast cancer can have on our health. Many of my patients, whether active or in remission, notice other impacts, may notice worry or stress, may notice changes in mood, changes in energy, disrupted sleep, might notice more specific symptoms like pain, hot flashes, nausea and vomiting with chemotherapy, and just generally maybe a change in quality of life. And sometimes traditional approaches are just not enough. So rather than stopping there or needing to stop there, here I've listed some approaches that do have science backing them. Those in bold have significant amounts of data now and are also quite easy to learn, quite easy to, I shouldn't say easy, but they're quite common now, and you can find them in many cases. Maybe I'll touch on worry or stress or anxiety because it's just so common. I mean, is there anybody here who has not experienced some impact of stress, like not sleeping well or not thinking well? When we think about stress and we talk about stress, we tend to think about it in an external way, like work is stressful, or a relationship is stressful, or something else, something situational is stressful. But when I talk about stress, I am really talking about it in a medical sense. I'm talking about our internal stress response. So we have a conscious nervous system, what tells me, okay, I am going to pick up this pen, I'm going to stand up, I'm going to walk outside. And then we have our subconscious nervous system, what we call our automatic nervous system or our autonomic nervous system in medical terms. And it's that subconscious nervous system that has two modes and often rules over this stress or this worrying response. Those two modes are sometimes called our fight or flight mode. That's that on and kind of amped up, heart rate higher, blood pressure higher type of mode. And the second is the rest and digest mode. That's the flip side of the coin, when our body is performing restorative functions. We are in rest and digest mode when we sleep. We're in rest and digest mode after eating. In reality, that rest and digest mode is closer to what should be our default mode, because we really evolved that fight or flight mode as a response to get out of life-threatening situations, which don't happen every day for most of us. So it's okay if we're in that fight or flight mode, or on mode, or go mode for a few moments at a time, or for a few days or weeks after something that is particularly difficult or traumatic. But when we're in that fight or flight mode day after day, week after week, month after month, maybe year after year, it can have significant health consequences. It even impacts our brain. When we're relaxed, our brain works properly. We're able to concentrate, focus, or pay attention to things that we want to. We're able to regulate our thoughts and our emotions and our actions reasonably well. And that's because the more highly evolved areas of the human brain, basically the parts of the brain that make us human, such as the prefrontal cortex right behind your forehead, are working well, and they're able to seamlessly communicate with lower down areas of the brain, communicating what those areas need to do. But when we're in stressed out mode, we preferentially activate different areas of the brain. We activate lower down, more primitive areas of the brain, such as the amygdala. And when we activate those are the areas that are also responsible for processing negative emotions like worry, anger, depressed moods. And those areas literally tell the more highly evolved areas of the brain, hey, you're not important right now. I am in a threatening situation, so I don't need to be able to focus on what I'm reading or concentrate. Interestingly, when we look at the brains of people who practice mindfulness or meditation, mindfulness is just another word for awareness. We see that those brain changes actually reverse. We can see that that more highly evolved area, like the prefrontal cortex of the brain, literally becomes more active and more closely connected to other areas of the brain. We see that that amygdala structure, that more primitive area of the brain, what we literally call our monkey mind because it's present in monkeys, that area can literally shrink and get less active. And we even see that the hippocampus, which is important for working memory and short-term memory, literally grows in size. So really profound impacts and changes that we cannot replicate right now with a medication or another strategy. I want to take a couple of minutes to introduce you to the Integrative Health and Wellbeing program if you happen to be here at Cornell. And if you're not, then look out for something like this that can bring you the resources, the information, the tools, the skills, and the healthcare team that you need to help make your care more effective. I'm going to just virtually introduce you to our team members. We have a team of physicians who are all trained in either family or internal medicine, as well as integrative medicine. We just had an integrative pediatrician join our team a couple of weeks ago. Her name is Michelle Loy, and so she is treating a lot of children now as well. On the previous slide, you saw Dr. Verhalen, who's our clinical psychologist. We have a team of acupuncturists, a team of nutritionists. Emily is our mind-body therapist, mind-body instructor, and she's excellent in taking care of a lot of people. If you're curious about some of the approaches and therapies that we have physician consultations. We offer nutritional counseling, acupuncture, psychotherapy, mindfulness, meditation, and massage therapy. A couple of these we're doing less of right now, just given lack of desire to bring together people in groups. We are continuing some of our group classes virtually, including our mindfulness meditation sessions. We do a free community session Monday through Friday at noon. You're all welcome to join if you would find it helpful. We offer an 8-week mindfulness-based stress reduction class, which is an 8-week class that was developed by a professor named John Kabat-Zinn up in Boston about 40 years ago now. And it's probably the best understood and best studied protocol in the Western part of the world. That's an 8-week class. It's on the more intense side. So each session meets for about 2 to 2.5 hours, but it's always a fantastic group. And it's hard to come out of that class without having learned something. These are some other resources for you. You will have access to these slides. So you'll get this link if you'd like it. That's the link you would use to join one of our free community noon meditations with Emily. The Mindfulness Meditation New York Collaborative is also an excellent resource, mindfulnessmeditationnyc.com, and American Cancer Society, Society of Integrative Oncology, and National Cancer Institutes are all great resources that you can use as well. So to sum up, the things that we can be thinking about in order to optimize our health are really going to be things that we can all do within our own homes, with our own families and friends every day. So eating and drinking well, eating mostly whole foods, largely plant-based diets, diets that are rich in veggies and fruits and low in refined carbohydrates and sweets. Think about opportunities to increase the cruciferous vegetable intake, increase green tea if you enjoy it, increase flaxseed, whole food-based sources of soy, and limit alcohol. Stay active. And I find this to be, because this one has always been tough for me as well. It's most effective if you can incorporate it into most days of the week. And a mix of aerobic activity that gets your heart up, such as biking or walking briskly or jogging if your joints can stand it, or swimming or the elliptical. All of those things are great forms of aerobic activity. I would aim for maybe half an hour of that 5 days of the week. And then also try to incorporate some strength and resistance training. Try to do that for maybe 30 minutes twice a week as well. You could tack it on to your aerobic activity. It's also very important for other things that tend to occur with age, such as declining bone density, osteopenia, osteoporosis. Don't forget about your overall health, your overall well-being, your quality of life, how you're feeling every day, moment to moment, how you're sleeping every day, how you're thinking every day. And there are a lot of approaches to dip your toes into if you're curious. And actually, a lot of people find acupuncture quite helpful in treating side effects of treatment, including hot flashes, including joint pains caused by aromatase inhibitors. And it's also effective for many people for chemotherapy-induced nausea and vomiting. So today we have talked about the role of nutrition in illness, but the flip side of that coin is wellness. When we look around the world at communities where people live long and live well, good quality of life, they do those four things. They eat well, they incorporate movement into everyday life, they feel like they can deal effectively with everyday challenges and everyday stressors. And the fourth is that they all had a strong sense of community. They had a support system, they had a social network. A lot of the times that community was a religious or a spiritual community, but it does not need to be that. It could be a purely social community. I highlight that one because right now I find that a lot of people are lacking that. Communities can take any type of form though. They can be in person. There are a lot of virtual communities as well. Maybe take some time in the coming week to rekindle a relationship or look into an old hobby or a passion or pursuit, something maybe that's fallen off your radar. And if you can identify one of those four areas where you feel like you have the confidence to move forward, focus on that. Start with one step. Slow, steady change is always going to take the cake over trying to change everything at once and then losing steam. Thank you so much. It's been a pleasure, and I'm happy to take any questions for the time that we have left.
Thank you for this review of what we can do for ourselves, not only with respect to breast cancer, but during these very difficult times of the COVID. And we certainly do have some questions. Question that I had received before your talk, which I think you have answered so beautifully. I hadn't thought of this before. Is there any non-prescription nutrient that a woman should take to decrease her chance of a recurrence of breast cancer? I think what you've taught us is that we don't have to go to the health food store. We can go to the grocery store. And those are the non-prescription nutrients that, well, might decrease the risk of recurrence of breast cancer. Is that the message I'm getting from this talk?
Absolutely. I think that's the key. That's the heart of it. If we were able to replace a healthy diet with a combination of nutraceuticals or supplements, I would be doing that. We have some information, and I tried to share the relevant information on those micronutrients today, but we don't have enough to create a cocktail of, or a combination of the ideal multivitamin, for example, for somebody who's trying to prevent the risk of recurrence. The key things are really eat plenty of vegetables and fruits, eat the rainbow, different colors every day. And then also try to incorporate the other aspects of wellness. Now, it's not everything. It's just what we can do.
Thank you. One question that came in is, there's so much available, and we can check on the website of the Integrative Medicine, Weill, Cornell, for those of you who'd like to look into it further. how does one woman choose what to do? Run to yoga in the morning, run to meditation at noon. What are there directions that the doctors should give them, the nurses should, or should they look over everything and see what feels right to them? How do you advise your patients?
It's a great question. It's a big question. Every person is an individual. On that slide where I was pointing out where some of these integrative approaches can fit in, I would, if you're interested and motivated to try something that you haven't tried before, or maybe you have tried it before and have found it beneficial, then I would suggest starting there. If you're really not sure where to look, or there's a concern because of a medication you take or a medical problem that you have, then it's important to talk to somebody first. So it could be one of our physicians, or it could be another board certified integrative and also practicing internal medicine or family medicine type of physician, somebody who can speak both languages and can understand the benefits of both. The nice thing about a lot of these therapies is they're usually well tolerated. The side effects of all of the things that we talked about are relatively minimal. So most people can safely try out some of the things that we talked about today.
Thank you. Thank you. And then here are some of the questions. There's a lot of interest in vitamin D. And I think that's for a couple of reasons. Partly, does it relate at all to cancer? And secondly, because of the pandemic and COVID. There's been a lot of discussion about vitamin D. Low levels of vitamin D associated with a worse outcome if you do get infected with the coronavirus.
So if the question is generally about, I might have missed the question. So the question is generally about vitamin D and immunity, and also in the context of cancer, right? Okay. So vitamin D, you're right. Vitamin D has been associated with many conditions, everything from heart disease to immunity to energy to certain types of cancers and many other things that I didn't just mention. We'll probably also continue to associate it with those. What is lacking in the evidence, and I don't say this just to be academic, but what is lacking in the evidence is causation. We haven't seen really great studies that show, okay, now if we increase your vitamin D level to X, then that decreases the likelihood of Y. Those types of studies don't exist. What we do know is that by boosting vitamin D levels into a therapeutic or normal range, or maybe slightly higher than a normal range, there may be an impact. There may be a benefit in some of those things. And then vitamin D levels also vary so much. So then the next question is always, how much do I take, and how do I take it, and how often do I get it checked? Vitamin D levels, that's converted in your skin and through sun exposure. So when you live in northern latitudes, like where we are in New York City, we tend to, vitamin D levels can often be lower. When you have dark skin, such as I do, vitamin D levels may be lower. So there are a lot of things that can influence vitamin D levels. So I usually suggest, again, somewhere in that range of 40 to 80, where it's higher than normal, but nowhere close to the range that you would need to become toxic.
We think of vitamin D coming from the sun, but you had pictures in your beautiful slides of salmon, eggs as two sources of vitamin D from the diet. So I think that's important for us to realize that we actually can get it from the diet.
Absolutely. Thanks for pointing that out. And dairy is another big one.
And dairy. We have quite a few questions from the audience about dairy. Milk, yogurt, cottage cheese, sources of the milk. What do you advise as far as dairy intake for our patients?
Complicated question. I love it. So the dairy question is a really important one to take individually. I I certainly see a lot of people who don't tolerate dairy very well due to a variety of reasons. The most common one is probably that it's quite common to develop lactose intolerance with every decade of life. So it's quite common to, at 40, be able to tolerate dairy just fine, and maybe at 60, notice that it causes a little bit of upset. So due to that big reason, I often see people who have gone dairy-free or really limited it. Now, there are certain benefits of dairy. It's kind of a whole food in that it contains all of your macronutrients in it. It's got fat, it's got carb, it's got protein. And if you're having it through a source, maybe not cheese, but if you're having it through a different source, like the yogurts or the cottage cheese, like you mentioned, that could be a really great source of a good protein and good fats. It can be quite nourishing in that way. So I don't really, and of course we know it's important for bone health, as well as other things. I don't have a blanket recommendation of whether dairy is really good for everybody or whether dairy is bad, because some people do better off dairy.
Thank you. Then we have quite a few questions about supplements. And a lot of our patients ask us about turmeric.
Good question.
You have an opinion about turmeric?
I do. I think that's a really interesting one. You know, that's one of the botanicals, plant-based things that has been amassing literature in a variety of different contexts over the last couple of decades. It falls into that category in this context of having interesting and good in vitro data, and we're just waiting for it to translate into good human data. It is an anti-inflammatory effect. Curcumin is part of the active component, one of the active components of turmeric. Turmeric is the root, it's that yellow, it's the root in the plant. And the anti-inflammatory effects can be quite potent. When taken in capsule or supplement form, it is at a much, much higher dose than it would be if you were to incorporate turmeric powder into your cooking, for instance. People who are taking tamoxifen, if tamoxifen is part of your treatment, that should be a consideration because it can impact the efficacy of tamoxifen. So that is an important conversation to have with your doctor. Even in those situations, it is probably safe and okay to incorporate turmeric through food form. So that's how I would think about it.
Good, thank you. Are there any herbs or supplements that would negatively impact a survivor, assuming that they're going to take them in the recommended dose that's on the bottle? From the health food store, for instance.
Right. Like I said before, there is no supplement or approach that I know of that only comes with an upside. So I would be wary of that. Another thing to think about is that in the US, dietary supplements, that all these botanicals and the vitamins and minerals, they all fall into the category of dietary supplements, and they're not regulated. So what that means is somebody can make something and it can end up on the shelves or in an online store or in a distributor without having proven either safety or efficacy, or even having proven that the capsules and tablets have the amount of what the bottle says it contains. It's a real concern because I've seen the negative consequences of that. That doesn't mean we have to be terrified to take any supplement either. It just means that we should think about it. At any time we start anything, we should be looking for a specific benefit. If we don't find that benefit, I usually suggest simplifying, pulling back, and stopping that, unless we know, based on science, that we know that it's going to have a beneficial impact. I don't know if that makes sense.
It does, and I think it points also to what the doctors don't know. So turning to your doctor and asking very often is hard, because we were not taught this in medical school. So I think it's hugely important and very wonderful to have your group to teach us and to help with our patients.
My pleasure.
And I would make one suggestion for the women who are on the program. From what we learned about what your doctors know about what you're taking, which is very little, I would suggest that when you go to your doctor's visits, your internist, your gynecologist, your oncologist, I would prepare a list of all the medications that you're taking, as well as any vitamins, any supplements, with the doses that you're taking, and show it to the doctors, and they might say, well, thank you, and put it on the table, but it will be in your chart. And I think that is very important, and it may even encourage those of us in the medical profession to learn more ourselves. So I would encourage that based on our research about what our patients are taking. So I'll take one more question. This is kind of a question that we sometimes get in the office. What about turkey tail mushrooms and breast cancer? Are you familiar with the studies? Now, when my patients ask me that, I say, no, I'm not. But together with the patient, we can look on Google. That's not 100% satisfactory. You must get asked that question about 150 different types of supplements.
I do get the question a lot. I'm going to be honest, and I hate to end on a note like this, but I don't know that I'm the best person to answer that question. I will often work with somebody who is a naturopath or has more experience with using something like turkey tail long term. My experience is just more limited. And when we're talking about something like breast cancer, I would defer to somebody who's been using it for a longer amount of time.
Well, it's nice to know that we have you there and your group to reach out to whatever experts you think would be helpful to us and to our patients. And thank you so much, Dr. Gupta, for your very helpful lecture today. Thank you. We hope to see you at our further lectures. We'll keep you all posted. Thank you very much.